I'm Dr. Tara, and this is Hopeful Hints, a podcast where you'll receive quick, hopeful hints on all things women's health and infertility. Here, you will find education, inspiration, and most importantly, find peace and empowerment as you walk through the next steps in your healthcare journey. And I'm your host, Dr. Tara. And today we're talking about a topic that I do not think gets talked about enough, but we're going to change that. I'm going to share some previous episodes on teenagers, teenage girls, and hormone changes and periods and acne and things I've recorded in the past. So make sure to head to the notes. I'm going to share previous episodes I've done there, but today we are talking about periods and teens. And I'm going to share a study in here that is going to blow your mind. And it was me. And I think it's going to be many of you listening today, even if you're not a teen. And my wish for you is to hit share on this. These are quick episodes. Send this to a teen that you know, whether it's your family, your friend, your neighbor. And let's do better for these teens than we had. I'm always wanting better than we had. So today's episode is all about understanding endometriosis as a teen because March is Endometriosis Awareness Month. And specifically, though, your periods, because that's one of the first signs and one of the only signs for some of endometriosis is period symptoms. So let's dive in and start talking about that. So as we know, endometriosis is not just a condition that affects adult women, okay? That's why we're doing this episode today. Dr. Malcolm McKenzie of Harvard Medical School performed a study and found that nearly, are you ready for this? 100%, nearly 100% of girls sent home or missing school due to painful periods have endometriosis. I'm going to say it again for those in the back. Nearly 100% of girls who were sent home from school or missed school or activities in school due to periods have endometriosis. In the episode I did with Dr. Adam Duke, he makes a comment that we also need to share here. If you were or are a girl with tummy issues, constipation, a young girl with these issues, it is in fact endometriosis until proven otherwise. So it's the bowel symptoms and the period issues. Yet, frontline healthcare providers are missing these symptoms. OBGYNs are missing these symptoms and dismissing them, worse yet, dismissing them as being normal, not a big deal. And teen girls are left to struggle with these painful and sometimes for many debilitating symptoms and this disease of endometriosis. They're missing school, work, activities. Yet the journey to diagnose them and treat them is rough and long. And we know a general statistic is 7 to 12 years to be diagnosed with infertility. So we've got to do better and we've got to start catching these symptoms as a teen girl and not dismissing it. And it starts with a lack of awareness too for healthcare providers. And when they say frontline providers in this study, that's someone like me who was a family healthcare provider. Specifically, I worked in rural health for over a decade. I saw this stuff all the time. We are uniquely positioned for that. Let's dive in and empower you to recognize signs of this, okay? So endometriosis in teens often goes unrecognized. Symptoms are severe menstrual cramps, pelvic pain, pain in your low back, your hips, your legs, or front of your legs, your knees, outside of your period too. This is, of course, assuming there's no injury, right? Even then, there's some that I've caught that are classic endometriosis. They've dismissed it as, oh, I just had an injury, in high school in that area, and they're like 30-some years old. And it's like, well, but you've had all the testing, right? And everything's normal. And they're like, yes, I just assumed it was because, knee pain, for example, due to injuries, or do we blame weight a lot? Now, can weight cause knee pain? Yes, but almost because in my practice, it's also endometriosis. So the daily activities, school performance, quality of life is just really rude. And when you start diving in and asking these questions of these young women, I always say within 10 minutes, I can make the diagnosis in my office. And I'm always talking about young girls Let's talk about the road to diagnosing. We know it looks different. It's challenging. They mimic other conditions. Symptoms of endometriosis truly is hard no matter what age because it mimics other conditions. And there's this myth that teens are too young to develop endometriosis. I'm going to say it again. It's a myth. We know now that it actually starts when they start budding breasts. When that estrogen starts to surge, we can look for signs of endometriosis. We use a combination of medical history, family history. I always ask about, tell me about I make a little joke of it. Tell me about your holiday conversations. Is there any conversations about hysterectomies with your mom, aunts, sisters, cousins, anything? Is there anything in the history where I'm looking for period talk, hormone talk, surgical talk, hysterectomies, signs where it's been missed before, or better yet, if they know that they have signs of it and it has been diagnosed already, there's a very, very high chance that if a mother has it, that that patient in my office has it as well. So we need to just understand that yes, it does mimic other conditions. And the most common ones I see too are, oh, you have IBS. Red flag for me for endometriosis, especially of the GI system. Every time I talk to a female who has IBS, I go back and she was the little girl tummy issues. I literally have that in my charts and I can see it right then and there. Sometimes in some women, we will do excision surgeon laparoscopy procedure and send them on. If it is debilitating, if that is a position that they, as a patient with their family, mother, guardian, have made, we will send them for a laparoscopic procedure. It's just really important that teens or guardians that they advocate for a thorough evaluation if they think they have it, especially if it's suspected, especially if there's family history of it. Treatment options. Let's talk about treatment options. So, treatment options include both medical, surgical, and alternative therapies as well. We are working to manage symptoms at this point, unless they're going on to excision surgery or for that diagnosis procedure. We are preserving fertility. And for some, it is curative. If you're going to go have excision surgery for endometriosis specifically, and we are going to an excision specialist, it can be curative for some. Many are met with here's your birth control, here's your birth control. So let's take the example of the females in my office where they come to me and we talk about they've been on birth control since they were teens. I always ask, what was the reason you were placed on birth control? Of course, if it was in addition to preventing becoming pregnant. And if there's any period conversations, I'm going down the endometriosis road. If there's acne or inconsistent cycles, I'm going down the PCOS road. But hormonal treatments are often the first offered in traditional medical settings, birth control. I'm seeing a nice trend away from a medication that's called Depo-Lubron. That is just not for teens anymore, in my opinion. It is ton of side effects, puts you in menopause, and it's got some bone issues that we worry about, density and osteoporosis and things like that. But the thing I need you to know, many are told that these will slow or stop the disease, but that's actually a myth. So getting put on medication does not slow or stop it. It helps manage the condition by regulating or suppressing your period. AKA, you stop the period, you stop your symptoms. It's not going to eliminate the growth or stop the growth from growing and developing. That is still there for endo. I really want to highlight the need for a multidisciplinary approach. At my practice, we're building a team. Not one person can be in charge of our health, in my opinion. I always say you get to create your team, and that is especially true for teens. We look at the pain. Is there any psychological support? Have a mental health provider located right in my clinic because I'm so passionate about addressing mental health because there's so much of it that comes along with this diagnosis. But it's really important for addressing the comprehensive needs of teenagers. It's something I wish I would have had as a teen, and we really need to create this support system. There's supplements that work for this. There's many safe alternative therapies that we can put people on that are natural if they want. Acupuncture, pelvic floor PT, chiropractor, you name it. The list we create for you to help manage your symptoms can in fact go far beyond just birth control. For teens and families who are hesitant about birth control, they need to know that there are alternative considerations.
pain management. I put together non-hormonal plans all the time. I love Jovi pain patches. There's these fun fanny packs. I'll put my link in today's show notes for all this stuff that a patient of mine actually found on Amazon that you can wear around, wear to school, wear to events. There's again supplements to help ease symptoms if you are wanting a non-hormonal approach to this. Lifestyle. We know that there's lots of lifestyle modifications, including diets that are anti-inflammatory and really working on that area, decreasing cortisol to help manage these symptoms. Again, I said acupuncture offers a nice alternative for some. Vitamin D can really help regulate some menstrual cycles, hormones, and help with some of those symptoms of endo. Again, it's just important to create that team that understands. I also love using low dose naltrexone in my practice. And yes, children, teens can be on low dose naltrexone when managed and prescribed by a provider who fully understands how to utilize this compound medication. So it works great. There's room for both to have both types of management available to you. Let's talk about my favorite thing here as we end: advocacy and support. Living with endometriosis as a teenager can really feel isolating. It was me. I am you. But support and resources are available. Advocacy starts with open communication with your family, with your healthcare provider, with your friends, finding online support groups, TikToks, Reels, all of these things nowadays. You will start to, I encourage that. I promote that. Of course, I am out there as well on TikTok, one of my favorite things. No shame here, but there's online stuff and resources where you get to learn and empower yourself and realize that what you are going through is real. And you get to create a team and network to help understand this better and point you in the right direction. And really, education is empowering. So you learning as much as possible without having a degree, but even though you're going to have a degree in the disease of endometriosis by the end of it, is really equipping you and your families to advocate for the best care possible. Endometriosis in teenagers is significant, yet it's unfortunately overlooked. And we've got to get better at early recognition, proper diagnosing, catching this right away. Even if you don't have surgery for 10 years, at least you've known for 10 years you have endo. So you're not like me walking into fertility, getting the diagnoses of unexplained when the entire years I wasted, miscarriages wasted, knowing the whole time if I would have had an endometriosis protocol in place right away, my story might look completely different today. So by shedding the light on teenage conditions such as endometriosis, I really want to help you foster more support, informed decision making, a community and team approach to your care, and really just ensure that you receive the care and understanding that you deserve. Check out today's show notes. I'm going to include more information and links available for you, and head over to social, say hi to me, Tara B Fertility, drop me a message. We are here for you.